Good afternoon. My name is Maria Jose, and today I want to invite you to be part of a solution that could truly change lives in Medellín. Medellín is known for innovation and resilience, but behind this image there is a hidden struggle. In low-income areas, thousands of people are living with untreated mental health conditions, many of them without even realizing it. I choose Medellín because this city represents both the challenge and these possibilities. It is a place where inequality is felt every day, but people have to also show extraordinary strength. It is in this community where change must happen and where it can start. Let's look at some numbers. Over 100,000 people have been forcibly displaced in the last 10 years. This doesn't just mean they lost their homes. It means they carry invisible wounds. Youth unemployment is at 24%, and many families live on less than 500,000 pesos a month. How can they afford therapy where they struggle to cover food and transport? In fact, there are fewer than 5 psychiatrists for over 100,000 inhabitants in Medellín. Compare that with the World Health Organization minimum recommendation of 10. And most EPS don't even offer regular psychological support. Clearly, this is not just a gap in service, it's a systematic failure. Had we invested in mental health earlier, entire communities might have been emotionally stronger today. Let me share a brief story with you. A 17-year-old boy in Comuna 13 dropped out of school last year. He was suffering from panic attacks but never got diagnosed. His school had no psychologist and his parents couldn't afford private care. Also, his teachers didn't know how to help him and he simply stopped going. Today, he is working in informal jobs, disconnected from education and support. That story isn't rare, it's far too common. Now, imagine this. What if his school had a psychologist? What if his teachers had been trained to recognize emotional distress? What if his family had access to free support in their local clinic? That's what we are working toward. A future where mental health is seen as an essential, not optional. So, what we can do? My proposal has 3 pillars: education, access, and collaboration. First, education. If students begin learning about emotions, empathy, and mental well-being from an early age, stigma will have decreased by the time they reach adolescence. And if teachers receive training, school can become spaces of emotional safety. Second, access. Mental health services need to be part of the public health system. Available in local clinics, included in basic health plans, and free for those who can afford it. Therapy should not be a privilege. Third, collaboration. The government, universities, and private companies must work together to make this possible. I'm not asking one institution to fix everything. I'm calling on everyone to contribute. And also, I have thought about how to measure this impact. I will look at reductions in emergency psychiatric admissions, improved schools attendance, and feedback from families who will be receiving ongoing support. I am also planning to use community agents, people from the neighborhoods themselves, trained to improve emotional first aid and guidance. This way, support comes from within the community and respect its contexts. Let's be honest, this won't solve everything overnight, but by 2030, if we follow this plan, thousands of lives will have changed. Families will be healthier, children will stay in school, and people will have learned how to ask for help, and they will have someone ready to listen. And the effect will ripple. Emotionally healthy communities build safer neighborhoods, stronger communities, and more resilient cities. I have learned something while reading this project. Mental health isn't about being happy all the time. It's about feeling safe, valued, and supported. And too many people in Medellín don't feel that way yet. So, here's my question for you. Who will you be in this story? Will you be the person who watches from afar or the one who steps in to make a difference? Whatever your role is, this is your chance to be part of something real, something urgent, something hopeful.